Today we're going to be talking about a very interesting topic, neurofeedback. Now this is something new to me, so I'm going to be sitting in the back and learning just as you will be. And we have Dr. Chea Hutton with us. She received her degree, her PhD, from the San Diego University for Integrative Studies in 2011. Her training in neurofeedback was with the EEG Institute under the tutelage of Dr. Siegfried Orthmer and Susan F. Orthmer. Please welcome Dr. Hutton.
Thank you for that introduction. Good afternoon, almost. Hope you guys got a couple little snacks. We have some water, coffee, and tea over there if you guys need anything. So like she said, I'm Dr. Chea Hutton, and I'm going to be presenting neurofeedback for the aging brain today. I'd like to start my presentation by sharing a testimonial from a client of mine. His name is James.
Hi, I'm James. I'm 48 years old, and I am a client of Dr. Chea's. I decided to try this neurofeedback therapy with Dr. Chea, and to my surprise, after my first 3 sessions, I had a full week, where I slept every night 6 or 7 hours. Most of the nights I slept 7, and one night I slept 8 hours straight through without waking up, and I couldn't remember the last time I had slept 8 hours in a night. And over the course of the next 5, 6, 7 sessions, my sleep got better and better. I would still have 1 or 2 nights where I didn't sleep well, but the majority of nights I started sleeping well. By the 10th session, I was pretty much sleeping well most of the time, and by the end of 20 sessions, I sleep 6 to 8 hours every single night. I never have a night where I don't sleep anymore, which has freed me up to add so many more things to my life. I can do my artwork and my music and the workouts and spend time with friends and family and not have to measure every day carefully what I can do. So it has been an absolutely miraculous turnaround in my life. I was a complete skeptic, but I'm very happily surprised. My whole life has become everything that I wanted it to be. So I am very grateful and feel incredibly lucky that by chance I met Dr. Chea and could have this treatment.
James suffered from a brain dysregulation, which impacted his sleep cycle. As all of you already know, the brain is considered to be our most vital organ. I would like to quickly recap what our brains do for us. It is responsible for our involuntary life support functions like heartbeat and breathing. It's also in charge of the essence of our personality and memory. How you think, how you feel, how you act, and how you interact with other people all has to do with the moment-by-moment functioning of your brain. The brain is involved in everything we do and everything we are. When your brain is functioning optimally, you function optimally. And in turn, when you have trouble with your brain, there's trouble in your life. Your brain allows you to get ready for your days in planning, grooming, eating, communicating with your children or spouse. You're able to negotiate through traffic while being on your cell phone as a result of the function of your brain. Not recommended. Planning trips, managing your business, evaluating your employees, attending luncheons, answering your emails. That's all accomplished by your brain's hard work. Your brain is the command and control center that runs your life. We often spend more time beautifying our hair and our skin and our clothes and remodeling our homes than we do caring for our brains. How our brain works influences every part of who you are and what you do. Brain health is essential to all aspects of the quality of life. Research does suggest that the aging process is associated with several structural, chemical, and functional changes, as well as a host of neurocognitive changes. As we age, our brains normally get less and less active. steady decline in our cognitive processes are inevitable across the lifespan. This decline starts as early as our 20s and our 30s. Irritability, anger, forgetfulness, agitation, insomnia, and snoring are some of the first signs that point to a problem of brain dysregulation. As we get older, our brains are not as efficient in managing our moods, our memory, executive functions like planning, working memory, attention, problem solving, verbal reasoning, inhibition, flexibility, multitasking, and sleep organization. Once the quality of our sleep declines, the rest of brain function also begins to decline. We should be sleeping 7 to 8 hours per night for optimal functioning. The quality of sleep is key to the maintenance of the immune system functioning. Memory is one of the best measures of brain function. The decline of memory function is one of the first signs of brain aging that might make the person that there's aware that there's a problem. 85% of medical conditions are either mediated or exacerbated by stress. As people get older, they have a progressively lower stress tolerance level. The brain enters a state of dysregulation when it is exposed to an increase of stress. There's a threshold, but beyond that, the brain will decrease in its ability to manage the situation. As people age, pain is much more common, and if it persists long enough, you can end up with full-blown chronic pain. Not having relief to that pain can often lead to depression. There can be obvious causes to pain, say from surgery or an injury, but dysregulation in your brain can make that pain worse or cause it to persist. The real focuses of medicine are on cancer, heart disease, stroke, and diabetes. Even in these diseases, the brain is directly involved with these issues. Once it is clear that one is dealing with one of these often fatal illnesses, having a more competent brain can assist one through this journey. Alzheimer's and dementia impact the memory. While they're not fatal per se, they do promote shorter life expectancies. It's important for us to know what our risk factors are for increasing that rate of brain aging that's inevitable. We're 2.1 times more likely to increase the rate of brain aging if we have high cholesterol. We're 2.3 times more likely if we have high blood pressure or hypertension. We're 2.5 times more likely if we have heart disease. We're 3 times more likely if we have a history of cancer or cancer treatment. We're 3.4 times more likely if we have diabetes. We're 3.5 times more likely if we have one family member with Alzheimer's or another cause of dementia. We're 4.4 times more likely if you have an alcohol or drug dependence. You're 7.5 times more likely if you have more than one family member with Alzheimer's or other cause of dementia. You're 10 times more likely if you've had a stroke. And you're 38 times more likely if you're over the age of 85. Age is a major risk factor for most of the common neurodegenerative diseases. So how can we reduce the impact of brain aging? Neurofeedback, which is also known as EEG biofeedback or neurotherapy, is a groundbreaking technique that challenges the brain to function optimally. This powerful brain-based technique has been successfully helping clients for over the past 30 years. It is a non-invasive procedure with dramatic results for a multitude of symptoms. Neurofeedback can be used to positively affect all of the systems impacted by aging. Neurofeedback can be significant to help type 2 diabetes to the point of even reducing insulin requirements. The brain is intimately involved with the regulation of heart function. Stroke recovery can be significantly aided with neurofeedback. It has also been proven to be useful in altering the immune system in a favorable status with regard to cancer. This type of treatment has also been proven to prevent the worsening of symptoms that are associated with Alzheimer's and dementia. Think of neurofeedback as a personal training session for your brain. Training the brain to function at its maximum potential is similar to the way the body is exercised, toned, and maintained. Neurofeedback enhances brain plasticity, and that refers to the structure and function of the brain. This ties to that old saying, if you don't use it, you lose it. Brain training exercises neural pathways that allow the brain to have better function in a variety of areas. This type of treatment allows the brain to look at itself as if it's looking in a mirror. If I notice that I'm hunching over when I walk by a glass, I'm going to straighten up without really even processing what I've just done. Somewhere deep inside, I know I should be standing up straight. But seeing myself slouched over gave me an opportunity to correct my bad posture. Like this, the brain can observe its own activity and thus make changes if it's not doing what it intended to do. I'd like to share a video with you that explains neurofeedback a little more in depth.
Any conversation about neurofeedback has to begin with a look at the brain. The brain is really an information engine. It's really oriented toward processing lots and lots of information at the same time. And in fact, the brain is rather self-absorbed. Most of what goes on in the brain is the brain talking to itself about itself. One key aspect of brain function is that neurons don't act alone. We've got 10 billion neurons up there in our glorious cortex. And if one of them does or doesn't do its thing, that can't really matter. If it can't matter, we can't suddenly have an automobile accident because some single neuron is acting up. So when we're looking at the EEG, for example, we're looking at those bunches of neurons performing in groups. The EEG is composed of a range of frequencies, all the way from 0 to more than 100 hertz, and the brain cares about each one. Without specially designed tools, we can now teach people how to generate more or less of these specific frequencies, and that has implications for brain function.
We like to think of neurofeedback really as a brain exercise, and specifically we're exercising the brain's ability to self-regulate.
The headroom that we have available for better function through brain training is much larger than the headroom we have available through physical exercise.
This allows you to wake up better, fall asleep better, pay attention better, calm down better, all of those state management issues that underlie good function. There's certain basic ways that the brain can fail to self-regulate appropriately. A person could be stuck in high arousal, have difficulty calming down, falling asleep. You can be stuck in low arousal, have difficulty waking up and being motivated. Also, the brain could just spiral out of its own control into a symptom like a migraine or a panic attack or a seizure.
At my worst, I was having a pretty major migraine several times a month that would last generally 3 days and sometimes would last longer, like 5 days. But I had headaches really every day, and I was taking medication throughout the day to try to control the headaches so they wouldn't become worse. And I was really at the point where they said the next step for me would be a preventative one. And then I would probably have to take this medication that causes you to drop words in the middle of your sentences, and it really affects your speech patterns, and it was scary.
Neurofeedback can be helpful with a wide variety of people, different ages, from very young children through adults, through old age, through people with very severe conditions, to people who want to improve their performance, who are already functioning quite well.
Recently, my mother suggested that I talk to a friend of hers who had done neurofeedback and had had great success. You know, I definitely feel that my stress level is so much lower now than it was.
So the variables for us are where do we put the electrodes and what frequencies do we reward, which turns out to be enormously specific from individual to individual.
I basically go in and I watch a monitor, and they teach my brain to stay in this certain range of levels.
Within the first session and from session to session, we need to dial in what is the most comfortable and effective reward frequency, how much do we need to get a person more calm or more activated. Once we have that worked out, then we can think in terms of placement, and we can get quite specific in terms of which brain functions we want to target by where we put the electrodes on the head. Neurofeedback session starts with putting electrodes on the head to measure the brain waves. Nothing goes into the brain, but we're measuring what the brain is already doing. And then we use those brain waves to drive the video game, which is the feedback to the client. For example, with inner tube, when the brain is achieving the goals that we set, then the rocket ship accelerates, makes more exhaust, which is a reward. If your brain goes off in the wrong direction, then a black fog comes in and obscures the tunnel.
So we're finding these ways of twisting the arm of the brain, if you will, to get it to react and do our bidding. And it's that, the push on our part and the push back on the part of the brain that affects then the gradual learning process by which the brain learns to behave better.
From day one of my sessions in neurofeedback, my headaches have started to decrease. I mean, really, it started to happen right away.
So this is a skill that the brain learns, and of course once it's learned it, it's going to hold on to that and use it every day so it won't forget. We start to see change rather immediately with neurofeedback. It has some impact within the first session or the first few sessions. Then we like to think in terms of 20 session blocks, because 20 sessions is enough to get a significant measurable change, and at that point there's a decision to be made of whether to go forward or whether we're done. So how's your head right now?
It's pretty good.
Over a number of sessions, we can get the brain to adopt a different style of functioning, which it then owns. And the person can then have a choice and say, hey, I don't need to live in anxiety anymore. I can choose to live in a calmer state.
I can really tell that my brain works differently. It almost feels like there's a lid on that's stopping my brain from going to the place that it goes to start the migraines. And I do feel a lot more peace in the way I look at my life. It's really been an overall sense of calm that I've gotten out of the process, in addition to the specific benefits of not having the headaches.
Neurofeedback is such engaging work because the more we do it, the more we learn, the more people we can help. And recently we've learned to do this training in a way that is more calming, which has extended our range to people with very high arousal, such as the autistic spectrum, severe chronic pain, agitation, anxiety.
And then there are the surprises that be helpful even with the degenerative conditions of the elderly, Parkinson's, the dementias, and so forth.
This is the frontier of neuroscience, and literally everything that the brain manages is coming within our reach. This has relevance to the children who are failing in our schools, to the homeless who are mentally ill, to the criminal population, to the addict in our society, to the elderly who are failing in their memory and their other capacities. And at the other end, it's useful to the sports performer who's at the top of his game, to the corporate executive, and to the stressed out housewife. Across the board, name it, it is useful and worthwhile to train the brain to better function.
The potential is huge.
Dr. Siegfried and Sue Othmer, the scientists, practitioners, and owners of the EEG Institute in Woodland Hills, California, trained me in neurofeedback. They have been successfully using this technique for the past 20 years. So what are the long-term effects of neurofeedback? A lot of people ask me, does the training really last? If the problem being addressed is one of brain dysregulation, like in James's example in the beginning, for sleep, the answer is yes. Neurofeedback involves the brain learning how to shift and maintain states. By bringing order out of disorder, the brain will continue to use its new capabilities and thus reinforce them. This gives individuals better functions from the brains they have. Matters are a little bit different when we're dealing with the degenerative conditions like Parkinson's or the dementias. This also is the case when we're working with insults to the system, like with the autism spectrum. In these cases, training needs to be continued over a period of time. We've also found that allergic susceptibilities and food intolerances make it more difficult to hold the gains from neurofeedback. This could also be the case for a child that's living in a toxic environment. They may also have difficulty retaining good function. The EEG was first discovered by a German psychiatrist by the name of Hans Berger in 1929. Research on the EEG and the exploration of brainwaves has been conducted ever since. I'd like to share an ongoing study that is being conducted right now with a Vietnam veteran in Los Angeles, California. The veteran has had 40-year history with post-traumatic stress disorder. With regard to PTSD symptoms, the overall improvement has reached 50% within his first 3 sessions, and reached 93% improvement after 18 sessions, which is where he is now. Even more significantly, his nightmares, flashbacks, suicidal thoughts, and binging and purging were all eliminated within those first 3 sessions. Another recent study was conducted with 71 individuals who suffered from migraines. They were split into 2 groups. The first group participated in neurofeedback, and the other group continued with their medication treatment plans. The neurofeedback group had a 51% reduction in migraine incidence to 0, meaning that they no longer had any migraine symptoms. 39% of the participants reported a reduced migraine incidence to just greater than 50%. In the medication group, 68% said that their headache frequency had not changed, and 9% said that their migraines were reduced to just greater than 50% incidence. The individuals from this study participated on average of 24 sessions. There have been numerous studies conducted on the effectiveness of neurofeedback. It has been proven to be helpful in impacting all of the following: ADD and ADHD. Neurofeedback has been proven to be helpful in enhancing attention and focus. Anxiety, autism, bipolar disorder and schizophrenia, cerebral palsy, chronic fatigue. James from the Testimonial was chronically fatigued. He wasn't getting enough rest and was always tired. Fibromyalgia, Lyme disease, chronic pain, depression, dissociative disorders, epilepsy, head injuries, migraines. I currently have a client, she's on her 6th session now, her name's Sarah, and she's been struggling with migraines for the past 10 years. After her 6th session, she's already reporting a reduction of the frequency and intensity of her headaches. So she's really excited about having some relief to her pain. Learning disorders, OCD and Tourette's, PMS, post-traumatic stress disorder. I also struggle with post-traumatic stress disorder. When I was doing my counseling hours needed to conclude my doctoral requirements, some post-traumatic stress symptoms resurfaced for me. I felt like I'd already dealt with it and moved on, but the trauma was still very present in my life and it was affecting my happiness. My psychologist recommended that I try neurofeedback to help with my symptoms. Not only am I free from post-traumatic stress symptoms, but I can sit and focus for longer periods of time, which came in really handy when I was finishing up my dissertation. I was also still performing as a figure skater. And when I would perform in front of the judges, I had this all-consuming nervousness that made it really hard for me to perform. When I was doing my neurofeedback sessions, it was easy to be in front of the judges. I didn't have that same nervousness in the pit of my stomach. I also had a debilitating fear of public speaking. I'd sweat, turn right, and be pretty close to passing out when I had to get up in just a group in front of maybe 1 or 2 people. So I'm standing here in front of you guys today without that horrible fear because of neurofeedback training. Once I realized the gains of neurofeedback, I took an internship as a technician for a year. After watching life after life change for the good from the neurofeedback, I knew I wanted to integrate it into my practice. Neurofeedback clinicians have very high expectations for success in training. When success is not clear, or if the gains are not holding, then there's usually a reason for that which needs to be pursued. So I talked a little bit about the child in the toxic environment. We need to, in those cases, it's really good to have the whole family in therapy to help the child keep the gains from the training. In the normal course of events, neurofeedback ought to work for everybody. People should make gains that they judge to be worthwhile. In 95% of Sue Author's experience from the video, the actual outcome exceeds the client's expectations. When people have such low expectations, the changes that can be produced with neurofeedback may even appear to be miraculous, like James said in the opening testimony. One EEG biofeedback office has a sign on its front desk and it says, "We expect miracles. If nothing happens, if none occur, something has gone wrong." What appears to be miraculous in all of this is really nothing more than the incredible capacity of our brains to recover function when given a chance. I'd like to share with you what some of the healthcare professionals are saying about neurofeedback. Linda Thompson, the author of the ADD book, says, "In my 38 years of practice, I've never seen any treatment that comes close to producing the results that neurofeedback offers. I've seen results achieved in days and weeks that previously took months and years to achieve, using the best methods available to us." Daniel Amon, author of Change Your Brain, Change Your Life, he says, "I've used neurofeedback in a comprehensive medical treatment program to help more than 1,000 patients with ADHD. When combined with supportive therapies such as family counseling and educational therapy, neurofeedback is the most effective treatment available. Critics of neurofeedback hold this treatment to more rigid standards than drug treatments. Yet, unlike drugs, neurofeedback is benign." Jack Woodward, a psychiatrist, says, "Among the newer approaches to managing ADD, the most exciting is a learning process called neurofeedback. It empowers a person to shift the way he pays attention. After more than 25 years of research in university labs, neurofeedback has become more widely available. This is a pleasing development because neurofeedback has no negative side effects." I'd like to share a video with you to close my presentation today. I've been so inspired by what neurofeedback has done for me as well as the clients that I've been working with, so I naturally shared it with my family. So this is a testimonial from my 32-year-old brother, Michael.
Hi, I'm Mike Hutton. I'm Dr. Shea's brother. A little short history about myself. I was in a serious car accident when I was 20 years old, and I had broken neck, brain damage, ruptured spleen, collapsed lung. I had nerve damage from head to toe on my left side, and really after all the therapy that I tried to do and did do, from acupuncture to stem cell treatment to all types of different things, block therapy, I only got to about 80% healed, and I couldn't fill the gap to get any better. And my sister got excited about neurofeedback because she really felt excited that this could be what I needed to fill that gap of the rest of the healing I needed. And boy, oh boy, she was right. Because after this past summer and doing 20 sessions of neurofeedback myself, I started getting some tingling sensations in my left side, from my arms to my legs, where I had my nerve damage in that never really completely repaired, and it changed everything. Like, I had no more muscle spasticity. I can think for long hours of time and hold a regular job now. I don't have anxiety problems anymore. My stress levels are lower. Everything that I was working towards to get better has gotten to where it needs to be, and I owe it all to neurofeedback and my sister.
So thank you guys so much for sharing your afternoon with me in this time. I'd like to open it up for any questions any of you might have.